Joining us is Daniele Schollenberger, a nurse practitioner and lead for Lehigh Valley Health Network's Concussion and Head Trauma program. We're talking about trauma and concussions from sports injuries. So welcome, happy to have you here with us.
Thank you.
Share a little bit more information. Tell me about your role here.
So my role at Lehigh Valley Health Network is as a concussion specialist, and what that means is that you are a licensed healthcare provider who is certified in diagnosing, treating, and managing the care of concussions.
That's wonderful.
Yes, I've been with the network for 40 years.
Wow.
I have been in trauma the entire time. The last 22 years, I've been a provider specifically caring for concussions and head trauma patients.
Wow, what a wonderful career you've had.
Thank you.
So, can you tell the viewers what is a concussion?
I can. So there are two definitions that are used most readily. One is a medical definition, and that is that concussion is a pathophysiologic process affecting the brain induced by traumatic biomechanical forces.
Boy, that's a mouthful.
The other definition is, you'll see more in media sources, and that is that a concussion is a brain injury that alters the way the brain functions. The point to be made about that is that concussions are treatable. So the definitions sound quite wordy and involved, but really concussions are treatable.
Okay, because that's good to know, because that can be scary, right?
Correct.
If your loved one has a concussion, particularly as it relates to a sports injury.
That's right.
So how many concussions occur a year from sports injuries? What are you seeing?
So the data that's out there I still find is startling. It is 4 million sport-related concussions in the United States every year. And they believe, the experts believe, that that is an undershooting of the numbers because so many concussions go unreported.
Wow, that's a lot.
That is a lot.
So you mentioned that concussions are treatable.
Yes.
How do you normally treat them? What's the plan of care for the patient if they come in to see you?
So I'll explain what happens. So injured athletes are referred to our program by family doctors, pediatricians, emergency centers, emergency departments, even healthcare centers at colleges, school nurses, athletic trainers, former patients. So the injured athlete comes in, and the first thing we do is a very extensive review of symptoms. There are actually 23 symptoms that we review with each concussed patient. And then we do a very detailed and focused examination, which includes a neurologic examination, a physical examination, and a very detailed and specific concussion assessment. After that, we have the clinical findings, we have the data, and so then we develop a plan of care based on the individualized clinical findings for that patient. That plan of care may include prescribing specialized concussion therapies. It will include perhaps developing academic accommodations if they're school age or college age, and also modifying their activities of daily living. Okay.
You mentioned 23 symptoms.
Yes.
What do you normally see? What are the most common symptoms?
So everyone, of course, thinks of headaches, and statistically, it's probably 90% of patients with concussion will have headaches. But what research has shown us over the past few years is that what's more important is dizziness or any visual changes, and then along with that, imbalance. So if a patient has dizziness after a blow to the head, or they have blurred vision, or they can't focus their eyes the same, their eyes feel sore or uncomfortable, that's actually more telling for us.
I'm fascinated by this subject. How long do you normally have a concussion for? Like, is it a couple days? Could it go on longer than that?
Yes, it can. So what's really important to know is that concussions, if you get a blow to the head and you're not sure if you have a concussion, concussions will still be there the next day and the next day and the next day. So if you are treated within the 2 weeks, you have a very good chance of having a quicker recovery. But actually, statistics show that even 10% of people untreated will go on with symptoms indefinitely. And actually, a recent pediatric article that came out in JAMA said that 30% of adolescents and young children still have symptoms 1 month later. So this is the untreated patient, the patient we're trying to get to come in for the assessment and treatment.
So are there resources available in the network at LVHN that if somebody has a concussion or thinks they have a concussion, that they can get the help that they need?
Yes. So my program, I'm the program director and the practice leader. My program has all concussion specialists. We have neuro-optometrists, and we have very specialized therapists. So we have a multidisciplinary team. So where we are right now assessing patients, one location is at one city center on Hamilton Street in Allentown. Another location is on Shanersville Road at LVH Muhlenberg. And a third location is at 447 Office Plaza, Building 200 in East Stroudsburg.
So you're here in
We're
this
here.
community,
Yes.
in this county,
Yes.
and able to treat patients.
Yes, we are.
So you mentioned about the referral sources. They can come from a wide variety. Can a person self-refer? Or if I'm a mother, can I refer my child if I think that he or she has had a concussion?
Absolutely.
Okay.
Yes, absolutely.
And so there's resources available. And I like the idea of the multidisciplinary team
Yes.
that works together to help put together a plan of care.
Right.
So we were just talking to one of our physical therapists, and is that an option for people, some type of cognitive therapy that potentially you could prescribe for them?
There are what are called clinical trajectories of treatment, and the first is a physical therapy type of treatment, but it's vestibular therapy. So it's about balance and about eye movements. There's also cognitive therapy, which is memory and thinking. And then we have what's called vision therapy, which is for patients that have prolonged, we call them ocular motor or eye movement symptoms that are really attributing to their headaches, their dizziness, their imbalance, and their difficulty with memory, focus, and concentration.
So what is the age range of patients that you normally see? Is it mostly pediatrics and adolescents, or can adults get a concussion?
So I just want to mention that at the Lehigh Valley Health Network Concussion and Head Trauma Program, we see all causes of concussion. So we see motor vehicle collision patients, falls, workplace injuries, injuries that occur in the home, and of course the sports injuries. So I am currently treating a toddler. So we have toddlers all the way up to older patients, because obviously older people may fall. Children fall as well, toddlers, that's usually the cause. Sometimes it's car accidents that a family is involved in. We see every sport every day. So we have a very large presence of athletes in our program.
Okay. Well, thank you very much for sharing. This has been really helpful in terms of having the resource here in our community, the plan of treatment, the idea that concussions are treatable, but the sooner that you get treated, the better the outcome.
Absolutely. Thank you, Elizabeth.
Thank you very much for your time.
Thank you.